All right, so now that we've covered important ways that generalized anxiety disorder can manifest and the various symptoms, as well as the course of how generalized anxiety disorder presents itself over the lifespan, and how to distinguish it from other anxiety disorders, now let's get into evidence-based treatment. So there are both psychological and pharmacological treatments that have strong evidence supporting their effectiveness for reducing generalized anxiety disorder symptoms and associated depression. The DSM-5 text revision, American Psychology Association, and NICE or NICE in the UK, as well as large meta-analyses, all identify several reliable treatment options. So let's get into them. So up first, if you're familiar with psychotherapy, cognitive behavioral therapy is the gold standard for many conditions, including generalized anxiety disorder. And psychotherapy consistently produces strong symptom improvement with a medium to large overall effect across multiple meta-analyses. So what does the research show? According to these meta-analyses, it's shown that CBT, cognitive behavioral therapy, reliably reduces worry, muscle tension, and generalized anxiety. Cognitive behavioral therapy is effective both during treatment and months after treatment ends. So it's important to note that clients or patients experience benefits even after the cessation of treatment. And how does the long-term outlook look like? So cognitive behavioral therapy is consistently shown to maintain significant advantages 3 to 12 months after treatment. So these benefits that clients or patients experience are sustained for many months, potentially years after treatment. Now, let's get into why cognitive behavioral therapy works. So, first, it targets maladaptive thought patterns, it builds problem-solving skills, and it includes exposure to uncertainty and feared situations. And this usually involves graded exposure, where clients are exposed to low threat situations that prop up their generalized anxiety disorder, and the degree to which a certain stimuli causes distress is gradually exposed to the client in an increasing way. So, something that the client ranks a 1 out of 10, we might start with that, and eventually something that the client ranks a 9 out of 10 in terms of the anxiety that stimuli produces would be exposed to the client gradually. And cognitive behavioral therapy also teaches relaxation and behavioral strategies. Now, let's compare psychotherapy to medication. So, psychotherapy generally produces larger improvements than medication alone, but it's important to note that this is influenced by how trials are designed. Clients also show a strong preference for psychological treatment. Studies show people are 3 times more likely to prefer therapy over medication. Now that we've compared psychotherapy to medication and shown how most clients prefer psychotherapy over medication, and that the effects of psychotherapy tend to be larger than medication, let's still get into the pharmacological interventions that are proven to be effective for those with generalized anxiety disorder. So, medication can be very helpful, especially when symptoms are severe, therapy is not accessible, or the client prefers a combined approach. So, again, when working with clients who have more extreme presentations of generalized anxiety disorder, and when they can't access therapy or when their access to therapy is inadequate, they might be good candidates for psychopharmacological interventions. And we won't get too far into the types of medications that are effective and how they work, but it's just important to note that these are the classes with the strongest evidence for generalized anxiety disorder. So here are the classes with strong evidence for generalized anxiety disorder. We have selective serotonin reuptake inhibitors, which are probably the most well-known, and those include sertraline, also known as Zoloft, and escitalopram. We also have SNRIs and buspirone, pregabalin, melatonergic agents, and these have emerging evidence and probably aren't as widely prescribed as the aforementioned options. We also have benzodiazepines, which are effective for short-term interventions, but not recommended long-term due to dependence, cognitive risks, as well as potential addiction or abuse.